Welcome to the Transforming Healthcare Coaching Podcast, where we're all about helping healthcare professionals like you create positive change at work, at home, and everywhere in between. Hi, everyone. Welcome to the Transforming Healthcare Coaching Podcast. And so this is our Father's Day episode. So thank you to all of the fathers out there. And also, it's one of our times where we celebrate and think about what it takes to be a healthy, thriving male in this world. I get the luxury of interviewing Klaus, our podcast director. Thanks, Klaus, for being on today.
I'm glad to be here.
So I'm wondering, what kinds of patterns have you noticed with how male healthcare professionals approach their work-life balance, especially those who are fathers? And I'd be curious to sort of hear whether you have noticed any changes in the different generations for how male healthcare professionals view what work life needs to look like.
Yeah, well, first off, happy Father's Day to everybody in healthcare, or everybody in general, if you're a father who may not be in healthcare. It's very interesting to talk about male versus female in terms of work-life balance, because there really is a very big difference. This is very generalized, and obviously everybody walks a different path. Not everybody struggles with the challenges with each gender when it comes to stereotypical roles and things like that. But in general, I think with men in healthcare, they absorb a lot of the challenges and they're not very vocal about it. They're not often telling people at work what they're struggling with, whether that be personally with their health, their mental health, physical, emotional, their well-being, even the pressures of being a man in healthcare. And when I think of men in healthcare, obviously I work with many colleagues from PAs that are men, physicians, nurses. They're very stoic. They're very big on just embodying strength, which it's not a bad quality. But I find that because of that sometimes, and not being able to open up about some of the challenges they're experiencing, that oftentimes that may follow them home. And so they may struggle with, and this is something I've witnessed with my clients, is that a lot of that is now challenges are affecting them at home, and they may be getting fights with their partner. They're missing games to see their kids. They're using substances like alcohol to kind of cope with a lot of the stress. They're smoking cigarettes or just binge watching TV, eating unhealthy because they're too tired to cook, because they just don't know how to release the things that are happening to them. But again, there's pros to it. There's pros to how men are at work too. I mean, we go to them because of their strength. I think of my men nurses and I'm like, I need help lifting a patient, or this patient, I don't feel comfortable in the room with them and I feel safe. And it's not to say women don't embody this at all, but even like when a certain critical patient comes in, when they're able to come in there, they're able to address things. They're not oftentimes very emotional with certain cases. And sometimes that has power. But I definitely see that kind of stoic behavior can sometimes be very challenging for our men.
Yeah, that makes sense. Do you think there's different cultural expectations around masculinity that also interplays for how different healthcare professionals, as compared to other industries? I think you probably also have coached people from other sectors, especially in the pre-hospital world. And I'm curious whether that plays any part as well.
Yeah, I mean, I think culture in terms of men in healthcare versus in other type of professions there is a difference. And I think men just add on to the challenges that we as healthcare professionals already experience and are not ones to oftentimes seek help. That's, I think, a big thing is the seeking help part. I find with the men that I've worked with in other professions outside of healthcare, they've been easier to open up. They sought the help first off, right?
Wow.
We, as you can probably talk to Lily as well, is that we do a lot of education or teaching people what is coaching. It's not therapy. It's very forward thinking. It's very for you, private space, and trying to break the bias of getting help. But I find that it's not as much of a stigma outside of healthcare. And I also think that just healthcare in general, we often don't like to go get help because we think we may have the answers because of our experiences, or we may not have the best healthcare insurance and we don't want to pay the cost. And we're like, oh, we'll wait until it gets to the point where it's like catastrophic.
Yeah, it's funny you say this because when I tell people about what we do, they're like, oh, my husband, oh, my friend, oh, my sister. they're in healthcare, they're a nurse, they're a physician. Oh, yeah, they would actually really benefit from this. Other industries have normalized the professional growth and development and what the role of the coach is supposed to be in those transitions and inflection points and leadership times. And it's just sort of normal to actually have that. And it's not for some reason in the healthcare industry. And so what I'm hearing you say is that while there are definitely some advantages for being a male in the profession, at the same time, it's probably across the entire profession that there's bigger problems of asking for help and sort of keeping things in and bottling things up and being stoic and not having a healthy way to process, think through, and grow from experiences.
Yeah, you said it right, and I think it also goes down to well-being. In general, healthcare professionals think they're well, or they think well-being and wellness is a taboo or
Mm.
a cliche thing to say, and really what it is just how to live your best version of yourself, be the happiest person of yourself, both at work and at home, to just achieve the things that you wanna achieve in a way that is natural, or it doesn't feel like you're just waiting for the next thing to happen, retirement, a big house. It's how you enjoy that process and journey, and this is something we've been trying to break, right?
Right. So, how do you address that superhero complex that many male healthcare workers develop? You feel like you got to save everyone, fix everything, and then you just basically neglect yourself along the way.
It is very hard to break that superhero complex. I find that people, again, being stoic has its pros, but it also has its challenges. It really takes the internal work of getting to know who you are, who you wanna be, and allowing that space to process. And when my clients reflect back to them the things that they say, like, I have to be this person, I have to be that strength, I have to absorb that, I can't shed emotion, I can't show my weaknesses, these typical ways of behaving in this manner, and it gets reflected back to them. It's like, well, why? And they're
Mm,
like, and the way that they answer sometimes, it does take some unlocking, but when they start to break that idea and start to live the life that they feel is truly them, I think that's when they start to really embody true wellness and well-being.
I really love that. Especially because I think a lot of times we don't give permission enough to both genders just that emotions are okay. And so I'm wondering in the right dose and the right frequency and leveraged in the right way, emotions are actually really powerful, both as data for decisions and just to be able to help you lead the team better. Emotions actually can be for your advantage. How do you encourage your male healthcare professionals to model emotional well-being for the next generation, whether that's their own children or the younger colleagues? Because what I'm hearing you say is that you unpack and they become more aware and they become more okay in their own skin, and part of being okay in your own skin are some emotions sometimes, either expressing them, naming them, recognizing them, acknowledging them, all those different things. So how do you encourage them to model something different?
Very difficult because this goes, I think, even just beyond healthcare. Nobody likes to be told
Mm,
or who they are, and technically that's what we do. It's the opposite of what we do as coaches
yeah,
anyway.
true.
But what the way I guide people is through reflection in the essence of, well, how has it been when you've suppressed your emotions? Or how has it been when you've embodied this way of keeping everything in? And what challenges did you experience? Because oftentimes people come to us, unfortunately, when it hits too far
Mm,
rock bottom instead of proactive and preventative, which is
right.
where coaching is amazing for. I'm not saying it's not great for people who need help getting out of the fire. And so people find us in that manner when it's just all crushed down and they have to unleash these emotions and these challenges they're having. And it's not easy. So to help colleagues, and this is more outside the realm of coach, is just being like, I think I do this already in my everyday life, asking them how they're feeling, how they're doing. How did that decision make them feel? And just acknowledging like that must have been tough, that interaction you had with that patient. How are you doing? And very typically, I find with my healthcare colleagues, they'll try and just shrug it off. But I find the more you ask, you're more likely you're going to get a response that's going to help them be able to open up and feel safe for that. And I think the other way is that I just embody it myself. When I had a difficult interaction, or even like, for instance, like I found metastatic cancer in a patient the other day and I was beaten up. I was like, this woman is young, she's so kind, and it hit me. And I was like, I need to take a step outside, take a few deep breaths. And I was rehearsing how I was going to tell this patient. And I would ask my colleagues, like, do you mind if I mock this with you? And these are ways that I do it as well. It's not a weakness to feel emotion and feel emotion for your patients even. And hopefully if you're able to do that at work, I'm hoping you'll be able to do that at home as well. I find people do this in the end, but it just takes them a lot longer if they're not working with somebody who can be in this private space with them.
Yeah, no, it's so true. You can't role model what you've never seen before. The imprinting learning process is a pretty fundamental one for all of us. We're always learning a new trick from each other. That's a really great example of how you will just be able to show up with each other, your own colleagues, and show them there is a different way of being, because when they get to receive the care and kindness from you, they have the opportunity to potentially give it back to others. And so I'm curious, how can we better reach male healthcare professionals who might benefit from coaching, whether that be in the early preventative stage or the I'm on the dumpster fire road? How do we reach our male colleagues, but they don't ever seek us out?
Yeah, it's tough. I think for us, we're continuously talking and reminding people that this is a safe space. If you reach out to us, it's confidential, even if you're just booking a discovery call and just want to get some more information or learn how we can help you. In that manner, it's completely safe. And so in terms of how we can reach these people, I think it's the more talking you can do, the more embodying we can do. Unfortunately, stereotypes are out there and different ways of acting and being in culture are out there. And so the way to break it is just us being natural the way we are, giving space to them and introducing what we do. I think, Lily, I think that's
Mhm.
what all I've been doing is giving people that safe space to talk to me about anything they want to talk about. And hopefully I can offer them the resources they need. If it's not me, it's therapy. If it's not me, it's encourage them to reach out to a different coach or to a friend to make the goals that they have a success.
Yeah, it's one of those things where you don't know what you don't know. I became more curious once I heard on a women physicians panel that one of the executive leaders had a coach. And then I went to another national organization, another leadership panel, and it was the guy who said, "Oh, my friends and colleagues, like you said, in another industry, they said, 'Do you normally would get a coach at this point?'" And he's like, "What is that?" And so he went ahead and did that. And that obviously projected his career growth significantly. And it was from me, it's like hearing from other people that, oh, they all had coaches too. Apparently you're supposed to do that at some point. So let me go looking around for that. And that'll be another episode that we can do in terms of how do you find the right fit and right types of coaches for the different things that you're looking for. But I think just normalizing that in many other industries that people do get coaches, and also in many other industries, men get coaches. It's not a girl boy thing. It's not a male female thing. And hopefully that just even through this episode, people can gain some awareness of the fact that we do serve all types of opportunities and possibilities in our
Yeah.
healthcare journey.
And I have my own coach, and I will say I probably embodied a lot of the things that my gender typically embodies. And I will say that I've become much more healthy and enjoy life so much better knowing that I can work with somebody in a very private space and focus on me and who I want to be. So
Yeah.
I encourage all our men out there to reach out to us if you're interested.
Yeah. And for all the women or men who are in their lives and have someone that you love who is in healthcare, hopefully you can share this episode with them, because even though this is our Father's Day episode, we actually coach all people in healthcare who fancy themselves somewhere on the growth journey trajectory of leadership, meaning that you can be a nurse, nurse practitioner, a PA, a physician. You can be of any specialty or discipline. If you're anywhere in the dream of leading your own life, all the way to becoming somewhere on the C-suite level, that's what we do here at Transforming Healthcare Coaching. So please like, subscribe, and share with a friend. And happy Father's Day.
Happy Father's Day.
Thanks so much for listening. If you found value in today's episode, please subscribe and share with a colleague who would benefit. Together, we can transform healthcare one person at a time. Find us anywhere you find your podcasts. Ready to take your healthcare leadership journey to the next level? Book a discovery call free at transforminghealthcarecoaching.com to explore our personalized coaching packages designed specifically for healthcare professionals like you.